So great to have you with us this holiday weekend. Among those taking off, the lawmakers who shelved a vote to repeal and replace the Affordable Care Act.
Senate GOP leaders and the president had hoped to get approval for their version of the health care bill before they headed home for the July 4th weekend and a 10-day break. But Senate Majority Leader Mitch McConnell could not round up the needed 52 votes, and there will have to be some major changes in the bill to get it passed. If it does get through the Senate, then it still has to go to a conference committee with the more conservative House of Representatives.
South Florida Congressman Ted Deutch is one House member who voted against its version of the bill. He is a Democrat representing Florida's 22nd Congressional District from Fort Lauderdale to Boca Raton, roughly, and as you see, here with us today. Good morning.
Good morning. Great to be with you.
And great to have you here.
Thank you.
The future of the Senate health care bill failed, obviously, to get the needed number of votes. What's going to happen here?
Well, I think we should be grateful that it failed to get the number of votes that it needed to pass. This is a terrible bill. There is a goal that we should all be striving for, and that is to make access to health care available to everyone and affordable to all. And
where does this bill fail?
And this bill fails because it fails on both counts. First of all, it strips away so many of the consumer protections that were in the Affordable Care Act, the kinds of things that required insurance companies to cover essential benefits like maternity and ER care and pediatric care. Right. It also would drive up costs, especially for people between the ages of 50 and 64. And it would gut Medicaid, which would have a dramatic impact not just on people getting access to health care through Medicaid, which would be bad enough, a dramatic cut there, but it would also have a huge impact on people in nursing homes and people pregnant women, people who are suffering from addiction who need access to treatment. All of them would be hurt by this bill.
So many of the same concerns that were in the House bill are now in the Senate bill. And this week, actually, we saw the Congressional Budget Office report that shows that 22 million people might lose their insurance, which is slightly less than the House bill, but still a staggering number of people. So this is not only a complicated matter on many levels, but so political. So who's going to blink?
Well, it's not a question of blinking, it's a question of actually standing up for your constituents and working together to do something to make their lives better. The problem right now is that for the Republican leadership in the House and Senate, Speaker Ryan and Majority Leader McConnell, their goal is a campaign promise. They want to, and this is true for Trump, they want to repeal Obamacare. We should recognize all of the benefits in Obamacare, in the Affordable Care Act, acknowledge where there are shortfalls that a lot of us have been saying we need to address to strengthen the Affordable Care Act. Some of us have been saying it for years, and then work together. Instead, they're going down this dangerous path to repeal it. The suggestion made just before we left Washington to repeal it with nothing else there that would cost tens of millions of people access to health care and hundreds of millions of people access to consumer protections that they need.
That's what President Trump said on Friday is just go ahead, repeal it, and we'll figure out a way to replace it. But even Senator Ben Sasse of Nebraska, who's kind of a moderate Republican, put that out there. What's wrong with that?
Well, think about the debate that we've been having. Think about the fact that we have a bill that the last poll I saw, I think is supported by about 15% of the American people. That's terrible. If you simply repeal the Affordable Care Act, you will lose all of the benefits that have accrued to the American people. You will put healthcare back, you put insurance companies back in charge of healthcare, and you would drive up costs, and tens of millions of Americans would lose their coverage. I can't understand why anyone thinks that that's a good result.
But isn't one of the biggest criticisms of Obamacare is that the insurance companies have pulled out of so many places that in some counties there is one provider?
Right. So and we need to look at the individual market, and that's an area where we have to work to provide more competition in order to bring costs down. If you look at some of the announcements that some of these insurance companies are making, they're making these announcements based on the fact that the President of the United States had said that he wants to unilaterally change this to make it harder for them to provide that coverage, to disincentivize their willingness to participate in the program. So in fact, we've got a situation where you've got a situation that we can work to strengthen, and you've got a president and leadership in Congress that is actively working to weaken it, and that I don't understand why that would be an approach that they would pursue.
Congressman, let's kind of take a larger look here, kind of a macro view. What the conservatives are trying to do, and President Trump promised during his campaign, is to, well, President Trump promised, in fact, to protect Social Security.
He promised he would not cut Medicaid.
And Medicaid. Well, but the conservative members of Congress, your colleagues, have said we need to cut back the entitlement programs. And Medicaid is about the biggest Medicaid entitlement program there is. And it's tremendously expensive. You're a former state lawmaker. Right now, Medicaid in Florida takes up roughly a third of the general budget. I mean, $27 billion goes to Medicaid. I mean, this just can't go on forever, can it?
Here's what would happen if this Senate plan were to go forward. When you see this $800 billion cut to Medicaid, which, by the way, let's be clear about this. The reason it's so important to make that cut is to then turn around and provide massive tax breaks to the wealthiest Americans. But when you see that cut, here's the decision that my friends in Tallahassee will have to make. They will have to then make decisions about whether to continue to provide access to care for people in Florida and people living in nursing homes, people who need, who are delivering, women delivering babies, people who need treatment for abuse. They're going to have to decide that, or if they're going to continue to do that, then they're going to have to make massive cuts in education, massive cuts in other parts of the budget. I appreciate what you're saying, Michael, because my colleagues aren't being so clear about that. This is really just an attempt to gut Medicaid and
wealth transfer.
And it's a huge cut that they're then not interested in using to do anything else with except to transfer it through tax cuts to the wealthiest Americans. If they would just be clear about that, as the way that people now understand this to be, we might actually be able to put that aside and move forward to strengthen the Affordable Care Act.
How can you even, there has been so little talk that I've heard, so forgive me if I haven't heard it, but how can you even discuss any of this without attacking the costs of medical care? And when people ask me, why are aspirins $8 each when I go to the hospital? I mean, I don't know how to answer that. Do you?
No, and I've met with I've met with doctors to talk about this issue. There are all kinds of ideas that would help bring down costs. We need greater transparency in medicine, in healthcare, so that everyone knows why the costs are the way they are, so we can bring them down. We need to give Medicare the ability to negotiate lower drug prices. That would reduce costs. Candidate Trump said that was something that he believed in. That's something we ought to do right now. But again, instead we're having the partisan debate about repealing Obamacare instead of actually strengthening health care for Americans.
On Friday, there was, as it were, a glimmer of hope. Some members of the Senate, Republicans, said, okay, we may not have to get rid of that 3.8% tax on investment income that the wealthy pay. And that would sort of ease or return billions, I don't know, $170 billion to the Treasury. And also there was talk about compromise. Let's bring the Democrats into the process. Let's bring in Bill Nelson and Susan Collins of Maine and other, Joe Manchin of West Virginia, other Democrats who may sit down with Republicans and somehow find a solution. Isn't that the way to go?
If the goal should always be to strengthen our existing laws, in this case, to ensure greater access to health care so that everyone has access, we can have more competition, and we can bring down costs. If that's the goal, if that's where we're trying to go, then by all means, we should sit down and do it. But if the starting point is we have to repeal Obamacare because that's what we promised to do, that would be devastating to the American people, and it doesn't show a willingness to sit down and compromise.
We have a lot more to talk about with Congressman Deutch. We hope you will stay tuned. We'll be back in 2 minutes.
Live in our studio this morning, Congressman Ted Deutch of the 22nd Congressional District, a Democrat. Congressman, need to get you on the record here about the tweets that President Trump sent out in anger the other day about Mika Brzezinski and Joe Scarborough on MSNBC. Everybody at home has seen them, but let's put them up on the screen briefly so you can see them again and we get your reaction. The president said, "I heard poorly rated at Morning Joe speaks badly of me, don't watch anymore." Then how come low IQ crazy Mika, along with Psycho Joe, came to Mar-a-Lago 3 nights in a row around New Year's Eve and insisted on joining me? She was bleeding badly from a facelift. I said no. When you heard that, what did you think?
I don't know how many times I've said that the president should stop tweeting, that this is beneath the office of the presidency, that it's not dignified, and that it's frankly embarrassing. That said, we shouldn't be surprised. Every time he tweets, he reminds us that those moments where we pause to think maybe now the president is going to start acting presidential, that it's only a matter of time before this happens. The problem is there are real issues that we need to be grappling with. The president is tweeting about this when there is this ongoing investigation into Russia's attempts to
which he calls a witch hunt.
Which he calls a witch hunt. Not only does he call it a witch hunt, and I don't know about the timing of this tweet, but he called that a witch hunt despite the fact that the entire intelligence community has acknowledged it, but then started this effort to try to gather all of the voter data from voters all around the country in order to start a voter
blur.
blur.
I feel compelled to say, just for balance here, that if the president's advisors were here with us today, they would say that I don't know if you watch Morning Joe at all. They are very critical of the president, and sometimes they get a bit personal. And I would guess that the president's advisors would say, look, the president feels like he doesn't have the press access that a president should have, and here he has his own Twitter feed, and this is how he hits back.
I think that we can agree, though, that name calling in the most playground-like way is not what we expect or should expect from the President of the United States. The President is off to Europe. He's going to be meeting with Vladimir Putin.
Held to a higher standard is what you're saying. The President is held to a higher standard.
Of course we should hold our President to a higher standard. Everyone should hold our President. That is hardly a partisan view. If we can't expect that our President is going to behave in a way that upholds the integrity of the office and the way that those around the world, we want those around the world to view the office, that's really challenging for the rest of us who are trying to advance America's interests.
You're on Twitter.
I am on Twitter.
When you tweet, what do you do before you hit send? Do you read 20 times and consider what you're saying and how it's going to be perceived?
Of course I do. Look, I do spend a lot of time. I often decide not to tweet things, not because they were too mean, but because they weren't clever enough, frankly.
Delete.
Right, but of course, it doesn't matter. It doesn't matter whether you're tweeting or whether you're speaking into a microphone or sitting on a panel with the two of you this morning. You have an obligation to think through what you're going to say, to not just blurt out things that might embarrass you or, in this case, the office of the president.
All right. Let's move on to a really serious subject. I know you believe it is serious, and that is this commission that President Trump has established to look into alleged vote fraud in the last November presidential election. He has said that 3 to 5 million people voted illegally, generally voted for Hillary Clinton, and he has appointed the commission, and one of the vice chairs is Chris Kobach, the Secretary of State of Kansas, a very conservative guy, and you say this is a sham commission. Why is it a sham commission?
Well, first of all, it's a sham commission because there is no evidence, zero, absolutely no evidence, that 3 to 5 million people, illegal immigrants, voted for Hillary Clinton. The president has made this point repeatedly. It has been refuted repeatedly by all of the experts. By
bipartisan secretaries of state and election supervisors.
That's absolutely right. And so the fact that this is an effort being led by the Secretary of State of Kansas, the person who is responsible for some of the the worst laws that are meant to try to make it harder for people, minorities in particular, to access the vote, shouldn't be surprising. And again, what the president ought to be doing, instead of talking about these fake voter fraud claims that he's making, he ought to acknowledge that there should be a commission, but the commission should be looking at the ways to strengthen all of our states against potential interference by Russia in the 2018 election, not this sham to go forward. But again, let's remember, in 2012, our governor led an effort to try to conduct a voter purge here that I helped to try to stop, and that was an effort that I think is being mirrored here. It's little wonder. I don't know if Governor Scott and the president talked about it, but the federal court stepped in that case, said that it violated federal law.
And this just bubbled up into the public consciousness because of the federal request for all the states to turn over so much of the voters' personal identifying information. That's why we're talking about
that's right.
This week.
Right, and thanks for clarifying, because this is an effort to gather. This is an effort for this group of Washington insiders, White House insiders, to gather a list of every voter, their party, their history of military service, personal information, and
Social Security numbers.
Social Security numbers, or at least the last four, but information that nobody would want to be out and available in the general public, certainly not on a national basis. That's the reason that there are so many secretaries of state around the country who have said, no, we're not going to provide that. Absolutely not.
Especially at this time of rampant voter theft, ID theft, or ID theft as a whole.
It's not hard. It's not hard to imagine the worst case, which is the White House collects this data, and somehow, either through a hack or disclosure or some other way, all of this information about hundreds of millions of Americans is available online for anyone. That would be a devastating violation of people's individual privacy rights.
Privacy rights, exactly. Ted Deutch, great to have you come in. Happy 4th of July. You will be marching with a band from your district in Washington?
Yes, the Spanish River High School Band was invited to come up to Washington, and I'm going to march with them in the parade up in D.C. It's my first marching band parade since I played the trombone in 9th grade.
Well, maybe they'll give you a trombone and you can blast away.
It would only embarrass them. I'm not going to do
Don't play the Washington Post March. I don't think it's very popular around the White House.
All right.